Okay, so, sometimes I get really fascinated by how professions that we think of as being totally different, like you would never really put them together, actually have some really interesting overlaps.
Oh, yeah, for sure.
Like, when you think about it, a veterinarian and a pediatrician, they're dealing with, really different kinds of patients, right?
Right.
But have you ever stopped to think about the fact that they both have this kind of fundamental challenge that they have to overcome?
Yeah, that's really interesting. I never really thought about that before.
So, in this deep dive, we're going to be exploring that parallel between these two fields, where the patients can't actually tell you what's wrong.
Right. Yeah.
And then we're going to shift gears a little bit and we're going to dive into the world of clinical specialization training.
Okay.
And for this, we're going to be drawing on the experiences of a neurologist. And all of this is from Professor Dr. Okan Blukbaş's work, Hastayla Konuşma Sanatı, which means the art of talking with the patient. So just think about it, right? Two completely different medical worlds, but they're united by this challenge of understanding patients who can't actually speak for themselves.
Yeah, that's wild.
So let's dive in. So in both veterinary and pediatric medicine, the doctor is basically relying on a third party to give them like really crucial information.
Yeah, absolutely. And for pediatricians, that's the parents, obviously. And for vets, it's the animal's owner.
Right. And the text really focuses on how it's not just about whether the caregiver remembers things correctly.
Right.
Like you can imagine it really matters how attentive they are, how invested they are, the sharpness of their memory, even their like intelligence, like their ability to grasp what's going on and then relay that to the doctor. It all becomes part of the diagnosis.
Totally. Because the doctor is essentially twice removed from the actual source of the problem, right?
Yeah, exactly.
And that's what makes the diagnosis so tricky.
And it's kind of like the doctor has to become a translator, you
Yeah.
know? They have to take the parent's worry or the owner's observations and turn it into like medical information.
Yeah.
And then obviously there's an added layer of difficulty when that translation isn't perfect.
Oh, for sure. And the text talks about how frustrating it can be for doctors to deal with caregivers who aren't observant, or maybe they don't seem that invested, or they just have trouble explaining what they're seeing.
Yeah, and you can imagine how that frustration might make a doctor feel rushed or irritable.
Totally.
And of course, we all know that when you're feeling rushed and under pressure, you're much more likely to make mistakes.
Oh, absolutely.
So the text makes this connection between that frustration and a higher risk of making diagnostic errors.
It makes sense.
Which, I mean, it makes sense, right? Because these fields are so reliant on someone else's interpretation of what's going on.
Yeah.
Okay, so now the story takes a sharp turn.
Wow, really?
And it plunges us into this whole other pressure cooker,
Okay.
the world of clinical specialization training. So we're seeing the perspective of a neurology resident and their last few years of training at a university hospital.
Okay.
And it sounds absolutely grueling.
Really?
So they were supposed to be having, these lighter night shifts as they got further along in their training.
Right.
But consultation requests from other departments would start pouring in like almost as soon as the night shift started.
So like on top of their regular patients.
Exactly. So just to clarify, what exactly does a consultation involve in this context?
So basically, it's when one medical team needs the expertise of another team.
Okay.
So in this case, other clinics in the hospital would call on the neurology resident whenever they thought a patient might have a neurological problem.
Got it.
And then the resident would have to go and evaluate the patient, sometimes do a physical exam, and then make recommendations.
Wow. So they'd be juggling all of that on top of managing their own patients.
Exactly.
Yeah, it's a lot.
Yeah, and it wasn't just the consultations that were constantly interrupting their work.
Right, the emergency room.
Yes, and anytime something went wrong with one of their own patients.
And that pager would go off.
Yes, that awful pager siren.
Right. It's like that sound becomes this symbol of how unpredictable emergency medicine is.
Absolutely. The text talks about how often those calls would come in, especially at night on weekends and holidays.
Oh, man. So they never really got a break.
It sounds like it. And to really understand how intense it was, we have to think about the context, right?
Okay.
So at the time, there weren't that many university hospitals, and the government had these policies that limited the number of residents they could have.
So basically, a smaller team was being stretched way too thin.
Exactly.
And then on top of that, you get this sense from the department head that there was this attitude that, like, the more patients you see, the better doctor you become.
It's like they thought endurance was a good quality in a doctor.
Yeah, like a badge of honor or something.
The pager became this trigger,
Oh, yeah.
You'd be focused on whatever you were doing, And then it would go off and you'd have to drop everything and deal with this completely unexpected crisis.
And then after they dealt with the emergency, they couldn't just relax, right?
Oh no, they'd have to go back to their own patients.
And the poor on-call nurse would have been dealing with everything on their own.
The text really emphasizes how much pressure those nurses were under.
Yeah.
They were often the first ones to respond to these really critical situations, and sometimes they even had to deal with verbal and physical harassment from patients' families.
Wow, that's awful.
It really highlights how important nurses are and how they often don't get enough credit for what they do.
Absolutely. And the author specifically mentions the nurses who could perform those life-saving procedures and make those initial diagnoses during these crazy night shifts.
They were lifesavers, literally.
And then on top of that, the neurology service itself is described as basically housing the sickest patients in the whole hospital.
Right, things like cardiac arrests, blocked catheters, respiratory distress, those were almost routine occurrences on that service.
It sounds incredibly intense.
It was a very high-stakes environment.
Yeah.
And the text compares how different it was to manage those crises during the day with a full team versus having to deal with them on your own at night.
Yeah, and you can imagine having to do all of that with anxious family members sometimes interfering or criticizing you.
Oh, absolutely.
Yeah.
That must have been so stressful trying to focus on the patient's medical needs while also managing the family's emotions and expectations.
And then there was this other problem, right?
Oh, yeah, patients who should have been in other departments ending up under the neurology resident's care.
Why was that happening?
It seems like some departments just didn't want to take on more patients.
So they just dumped them on the neurology resident.
It sounds like it.
Mm.
And obviously that added to the resident's already overwhelming workload.
Plus, they must have been worried that those patients weren't getting the right care.
For sure. And then on top of that, they had to try to convince the on-call doctor from the correct department to actually take responsibility for the patient.
It sounds like a nightmare.
It was. And the text talks about how stressful it was to have to face senior doctors during morning rounds if they hadn't been able to transfer those misassigned patients.
Yeah, and it sounds like the hierarchy within the medical system made it really difficult to challenge someone more senior than you, even if you knew they were doing something wrong.
Exactly. And the author specifically mentions this one doctor from another department who would just act like nothing had happened, even though he'd basically dumped a patient on the neurology resident.
That's so unprofessional.
Yeah, and it must have been incredibly demoralizing for the resident.
So the author mentions that the residents would often debrief on the hospital cafeteria's terrace.
Oh yeah, that terrace had a beautiful view of the Black Sea and the Kaskar Mountains.
That sounds nice.
Yeah, but even though it was a place where the residents could relax and talk about their experiences, the hierarchy still played a role.
Oh, right. So they couldn't really speak freely?
Not really. Junior residents, like the author, felt like they couldn't criticize senior residents, even if those senior residents were doing things that could harm patients.
It sounds like a really unhealthy system.
It was, and the text really emphasizes how serious the consequences of these problems could be.
Right, like patients not getting the right treatment or even dying.
Exactly.
Okay, so after describing all of this, the author focuses on one specific night of consultations.
Okay.
So they had already had a really long day seeing patients in the outpatient clinic and working in the neurophysiology lab and going to meetings.
It sounds exhausting.
It does. And then they had to take over the night shift from the day physician.
Okay.
So they checked the board to see which departments needed consultations, and there were only 3.
Okay.
One from the burn unit, one from surgical intensive care, and one from psychiatry.
Not too bad.
Yeah, at first it seemed manageable. The author even thought they might have a chance to chat with a colleague for a bit. And the psychiatry clinic is described as being really different from the rest of the hospital.
In a good way.
Yeah, in a good way. It's like it had this sense of calm and security.
Nice.
So it had its own kitchen and nicer amenities, and the whole environment was just more controlled.
So the patients were probably calmer too.
I think so, yeah. The text describes the layout with a waiting room and a long hallway and a common room with these like pastel green walls.
Oh, wow.
Yeah, it sounds pretty peaceful, and the patients could actually socialize in the common room until dinner time.
So it sounds like a much more therapeutic environment.
Exactly. And then we're introduced to this really interesting character.
Okay.
His name was Safet Sukusu.
What an interesting name.
Yeah, I mean, Safet sausage maker. So he was the nighttime auxiliary staff member at the psychiatry clinic, and he was known for always having a smile on his face.
That's nice.
Yeah, and he would show up late at night with all these groceries.
Groceries.
Yeah, I know it sounds strange, right? But he would make this huge feast for everyone.
Wow, in the middle of the night.
Yeah, and apparently he had this really calming presence, and the patients really liked him.
So he was kind of like a night watchman,
Yeah.
but he also cooked for everyone.
Exactly. And the text describes how he would start cooking around 3 in the morning, and he would tell these amazing stories about the old port city.
Oh, wow.
And there would always be pan-fried sausage, of course.
Hence the nickname.
Right, and sometimes even the non-clinical staff, like the author, would join in.
Really?
Yeah, and apparently Safé would get really offended if he didn't eat his food.
He sounds like a real character.
He was, and it must have been so nice to have that sense of community and good food in the middle of a stressful night shift.
Absolutely. And the psychiatry clinic had this beautiful view, too.
Yeah, overlook the sea.
It's hard to imagine a better place to escape to in the middle of the night.
Right. So with just those 3 consultations, the author decided to head to the burn unit first.
Okay.
And the burn unit is described as this really difficult place to be.
In what way?
Well, the text talks about how you could hear the patients screaming in pain from floors away.
Oh, wow.
And there was this constant sound of crying and moaning, and the smell was really bad.
What did it smell like?
It was this mix of like dressings and wound care products and disinfectant and burnt skin.
My God, that sounds awful.
Yeah, it was. And the staff who worked there were often people who were being punished for something.
So it wasn't a desirable place to work.
Not at all.
Yeah.
So the author finds the on-call nurse who's completely exhausted and is directed to this patient named Svetlana.
Go.
And Svetlana was a 21-year-old woman who had finished her burn treatment 4 weeks ago, but she wasn't communicating with anyone.
So that's why the neurology resident was called.
Right. The general surgery resident thought there might be something neurological going on, but it seemed really strange to the author.
Why?
Well, Svetlana looked like a normal young woman. She had short blonde hair and a small nose and blue eyes, and she just seemed really quiet.
So it didn't seem like there was anything obviously wrong with her?
Exactly. And the author even wondered if maybe the surgery resident was just too tired and had left out some important information.
Right.
So the author goes up to Svetlana and greets her in Russian.
In Russian?
Yeah, the author knew a little bit of Russian, and they said something like, "Good evening, how are you?" And Svetlana replied perfectly in Russian.
Oh, so she could speak.
Yeah, she just didn't speak Turkish.
Wow, that's a pretty big oversight by the surgical team.
Yeah, the author was pretty critical of them in the text. They basically said that the team hadn't even tried to communicate with Svetlana in any language.
So they were just treating her like she was some kind of robot.
Pretty much. And the author goes on to explain that this was happening more and more at the time because of the collapse of the Soviet Union.
Right.
So there was this huge social crisis, and a lot of people from former Soviet countries were ending up in Turkey.
Yeah.
And Svetlana's story is really tragic.
What happened to her?
So she was a victim of human trafficking, and she had been through all kinds of horrible things, and eventually she tried to kill herself by setting herself on fire.
Oh, my God.
Yeah, and she ended up in the burn unit while she was running away from her traffickers in a country where she didn't even speak the language.
That's heartbreaking.
It is, and the author makes a really good point about how surgeons sometimes focus so much on the physical aspects of healing that they forget about the patient's psychological well-being.
Right, because Svetlana was obviously dealing with so much more than just her burns.
Exactly, and that whole experience got the author thinking about how important it is to examine a patient's consciousness, especially in neurology.
Yeah. Why is that so important?
Well, sometimes when a patient comes in with an altered level of consciousness, you don't have time to wait for brain imaging or lab results.
Right, those things can take a while.
Exactly, and the neurologist has to figure out as quickly as possible what part of the nervous system is affected.
So is it a problem in the brainstem, which controls things like breathing and heart rate?
Right, or is it in the cerebral cortex, which is responsible for higher level thinking?
And that distinction is really important because if the brainstem is involved, the patient needs to go to intensive care immediately.
Exactly, because their breathing and circulation could be at risk.
So even if the patient can't speak, you can still get some clues about what's going on by how they respond to things.
Right, and this leads to something called Ribot's Law.
Okay, I've never heard of that. What is it?
So it's this observation that when a patient's consciousness is impaired, they can usually only understand and respond to questions in their native language.
Oh, that's interesting.
Yeah, even if they speak other languages, those languages become inaccessible when their consciousness is affected.
So basically their brain reverts back to its most basic form of communication.
Exactly. And that's why it's so important for neurologists to know basic greetings and commands in a few different languages.
Right, because if they can communicate with the patient in their native language, they might be able to get more information about what's going on.
And that could help them make better decisions about the patient's care.
So simple communication can really make a huge difference.
Absolutely. Okay, so to recap, we started off by talking about this unexpected connection between veterinary medicine and pediatrics.
Right. The fact that they both rely so heavily on caregivers to communicate what's wrong with the patient.
And we talked about how crucial it is for doctors in those fields to be really good at interpreting what they're hearing from the caregiver.
And how frustrating it can be when that communication isn't clear.
Then we dove into the world of clinical specialization training.
Through the eyes of a neurology resident.
Right. And we saw how demanding and stressful that training can be.
With all the constant interruptions and the pressure to make quick decisions and the hierarchy within the medical system.
And we heard Svetlana's story, which highlighted the importance of communication and empathy in medicine.
And how our assumptions can sometimes prevent us from seeing the bigger picture.
And finally, we learned about Ribad's law and how it can help neurologists assess patients with impaired consciousness.
It's been a really fascinating deep dive.
I hope it sparked some aha moments for our listeners.
Me too.
So as we wrap up, I want to leave you with a question to think about.
Okay.
We've seen how difficult communication can be, even when language isn't a barrier.
Right.
So how often do our own assumptions, both conscious and unconscious, shape how we understand other people? Not just in medicine, but in every aspect of our lives.
That's a really good question.
And what other seemingly different fields might actually have similar challenges that we just haven't recognized yet.
It makes you wonder what other connections are out there just waiting to be discovered.
Exactly.
Well, thanks for taking us on this deep dive.
Of course, thanks for joining me.
It was my pleasure.
Until next time.
Bye.